Good evening, everybody. Hope everyone's having a good evening tonight. Gonna let a few seconds here for the feeds to catch up. So, again, this is Dr. Stephen Walker, broadcasting live on Facebook, Twitter, and YouTube. Hey, Severina, how are you? Thanks for joining. Please share this. So just going to let a few people log on. But tonight we're going to talk a little bit about medication. Hey, Allison, how are you? We're going to talk about medication. We're going to talk about getting off our medication, why we're taking medication. Good evening to you too, Severina. Hope you're having a good night. So we're just going to wait a little bit for some people to log on and some live feeds to catch up, but we're really starting to pick up some momentum here with people logging on and asking great questions. We've had a series of really good discussions about mental health, mental illness. So I want to keep that going. So again, if you have a specific question, feel free to ask it. Because again, remember, this is not just about me posting videos, wanting to get likes and shares. This is about actually helping people talk about their mental illness, their mental health. Remember, everyone has a degree of mental illness. Everyone, just like everyone has a degree of physical illness. Everyone has a degree of mental illness. You got to work on your degree. So let's talk a little bit about medication. You know, I've worked with thousands of clients as a licensed psychologist, and some have been on medications their whole life. Some have been overly medicated. Just let me say this straight up. I am not anti-medication. I think medication has its place, but it's overly prescribed. It's given to people a lot of times by physicians who have zero mental health training. It's given by psychiatrists who thankfully have mental health training, but they don't have a lot of therapy training. So they're basically just getting patients in and out. This doesn't work, try this. This doesn't work, try this. This doesn't work, try this. There are a few enlightened psychiatrists out there who see a value in what we do as psychologists, helping people work through their different degrees of trauma. So just to talk about medication in general, most of the medications that are prescribed that people are taking now were never studied for long-term use. They were never developed by Pfizer or any of the other pharmaceutical companies. And they said, hey, before we release this into the public, we're going to do a longitudinal study on, hey, Miranda, how are you? We're going to do a longitudinal study on how this affects people over time. None of that was done. There were few, if any, studies on the effectiveness of these medications for children. None of them were really studied. But the main issue I have with medications is how they're prescribed. They're first off prescribed way too much, and they're oftentimes prescribed by telling the patient, you'll be on this the rest of your life. They're rarely, if ever, given to a patient by saying, look, we're going to give you this for a short amount of time. I want you to call this, find a counselor, find a psychologist, or I work with this man or lady, and I want you to work through what's causing you to need the medication. Why do you need the medication? So remember, guys, if you're logging on, please share this, okay? Please share this on your timeline. Pull some people in. We're talking about medication. We're talking about why we take so much medication. So a lot of times it's being given to patients without any context. The analogy I use with all my patients, and I've used it for years, is imagine you break your arm, okay? And the doctor, the orthopedist, tells you, oh, you're going to have to wear this cast the rest of your life. Well, of course, they're not going to say that because the cast is meant as a short-term aid to immobilize your bone so that your body's ability to heal will then take over and heal it. Imagine if you kept the cast on the rest of your life. What would happen to your arm? What would happen to the muscles surrounding your arm, your leg, whatever? Okay. Dennis is asking a question. Great, Dennis. So I'll get that and ask your question so that I can start going down them. Remember, this isn't about me just talking. Okay. There's enough people out there doing that, and I don't want to be one of them. I want to be somebody who is engaging with the viewers. I want to get feedback. I want to know what's going on. So Dennis, thank you. You're the first question up. I'll get to you in a second. So when a physician gives a patient a medication and tells them you're going to be on this the rest of your life and gives them no hope to work through what is causing them to need the medication, that sets in their brain, and then the person begins to develop a self-image around that, about somebody needing medication. Again, not saying I'm not anti-medication. I am anti the way it's prescribed. So one of the things I've tried to do for years is help people wean off their medication. We don't ever want anyone to cold turkey their meds and say, screw this, I'm not taking this anymore. But yes, I do encourage everyone out there on anxiolytics, anti-anxiety medication, antidepressants, whatever mood disorder, any medication that affects your mood, please try to get into, why is my mood in need of medication? What is going on with me? What trauma haven't I worked through? What is going on with my depression? What are the beliefs around my depression that are causing me to be depressed? So when I'm working with a patient or a client on medication, I'm basically assessing, why do they need this? Why are they taking this medication? What is the point of what's the treatment plan? If the treatment plan is, I want to be numb and just not feel anything, well, that sounds like someone's given up. Someone's buying into the idea that they can never heal. So we definitely want to question why we are taking this medication. Engage with the person who has prescribed it. So if it's a general practitioner giving you antidepressants, ask them, hey, do you have any mental health training? Like, why are you prescribing me a mental health medication and you don't really have any mental health experience? Can I see some studies on, you're telling me to keep taking this the rest of my life? Where's the study that backs that up? Can you show me the effect it's going to have on my liver, my kidneys, my internal organs? So please, people, question what you're taking. Ask yourself, why am I so depressed? Why am I so anxious? What am I believing about my ability to heal? Why am I thinking that I want to be numb? And that's what I've heard thousands of times from people. Sure, antidepressants work, but what they do is they cause you really not to feel much, good or bad. And again, I don't know if anyone's ever explained, what an antidepressant is, but I'll give you a quick 2-minute version, then I'll get a 2-minute explanation, then I'll get to some of the questions. Again, people, please share this. Please bring in some people on this. Discussions about mental health and mental illness, we need to have them. So let's take real quick antidepressants. Most of them are what's known as SSRI. There are many different classes of antidepressants, but I'm going to just talk about SSRIs. SSRI stands for selective serotonin reuptake inhibitor. The last two words are key: reuptake inhibitor. People think that these antidepressants create serotonin or make you feel good or whatever. Couldn't be further from the truth. So what happens is this. Imagine this is kind of what a neuron looks like. It's got a thin body and a flat head. Okay? Don't say that looks like me. But anyway, so the two neurons are like this. Basically, they never actually touch. Hey, Diego, what's going on, man? I'll get to you in a sec. Thank you. We're talking about medications. So the two neurons never touch. They come real close to each other, and in between this space, in between the neurons, is what's called a synaptic cleft. And what that means is this neuron gets excited by something happens, and then boom, it releases serotonin into the synaptic cleft for this neuron to take up and then to start the feel-good process. Just doing this in layman's terms, okay? So remember, selective serotonin reuptake inhibitor. That's what an SSRI works on. The SSRI works on the neuron that's releasing the serotonin and prevents it from reuptaking it back in, because believe it or not, the human body is such an amazing, thanks Severina, please share this. The human body is such an amazing thing, is that this neuron that's releasing all this serotonin says, whoa, that's too much serotonin. So it starts sucking it back in, reuptaking it back in. So the SSRI comes in, shuts down the reuptake pump, boom, more serotonin in the synaptic cleft. And by the way, this is happening billions of times in your body, believe it or not. Okay. It takes in all of that, gets upregulated, needs more and more and more. And then you get basically why you can't cold turkey it. The minute you cold turkey it, this neuron goes into basically spasms saying, where's my serotonin? And it causes a whole bunch of problems. I am not saying to get off your medication without working on the issue that caused you to need the medication. Okay, people, I'll come back to this after we get to some questions. George seems like he's a new viewer. Great, George. Beautiful. Okay, so Dennis first. Can someone develop bipolar disorder by dealing with someone that is bipolar? Excellent question. Excellent question, man. Biologically, probably not, but the ups and downs of being associated with somebody on bipolar, and specifically if they're not medicated, that can be a problem. And many people don't know that there are two types of bipolar. There is a bipolar where there's more mania, meaning the person's up. Oh, they're just going a mile a minute and boom, 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 boom. And then they crash down into some depression, but then they're pretty much, it's marked by more ups, more mania. The other form of bipolar is the opposite of that. You get some manic, but you're primarily down. You're probably primarily more depressed. So, Dennis, and I know, Dennis has been very open and honest with some of his struggles with his wife, but, you can definitely develop your own situational bipolar, meaning that when she's up, you're feeling good. Oh, cool. Everything's great. And then when she's down, you crash down. Absolutely. So, but can you develop, biological bipolar from being exposed to somebody else? I mean, it's a great question. I don't know if it's ever been studied. My clinical intuition is probably not, but I'll tell you what, the human body is such a mystery in many ways. What I would recommend to you, Dennis, is you've got to start asking yourself, brother, how long can I be on this ride? How long can I stay in this ride? And I'm married too, as many of you guys know, but the whole for better or for worse, at some point you're going to have to ask yourself, which is outweighing what? And, Dennis, I would definitely ask you to ask yourself, what is keeping me in a relationship with somebody who I feel is causing me to be bipolar? Now, I don't know what you mean by bipolar. Maybe you can follow up and, shoot us a follow-up of what you mean by bipolar, meaning are you like you're up and then you're down, or are you primarily down? What you explained to us the other night about some of the things you're going through with your wife, that would lead me to believe that you are probably more down than up, because when you're with somebody who is on a drastic up and down, you never know when to relax. Excuse me. You never know, is she temporarily good? Is she gonna drink or whatever? So, if you feel you're developing a form of, kind of collateral bipolar, brother, I would definitely encourage you to work on that and figure out like what is causing you to feel these feelings. Why are you continuing to stay in a situation that is causing you to feel this way? So, and trust me, Dennis, I know it's not easy to just, you see it in the movies, just pack up and leave that person behind. It ain't that easy in real life. I'm sure there's a lot of time, a lot of history that you guys have. So I feel for you, brother, but I would encourage you, if you feel you're developing, what I'm coining tonight is situational bipolar, you got to work on that, bro, because it's not going to get any better. It's not going to magically go away by, if she's not working on her issues, then those issues are going to keep affecting you. So thanks for the question. Feel free to follow up with something else. So George is asking, my training was always to look at meds as a crutch, a way to keep you going until you can find a long-term cure. Great. Well, a crutch is actually a good metaphor, because if you think about it, George, if I said before, if you break your leg and the orthopedist or whoever's working with you gives you a pair of crutches and says, you're going to need these the rest of your life, then you're going to probably follow that advice to some degree and think, I need these the rest of my life, which is going to cause your leg, your muscles to atrophy, the bone not to probably get brittle. So there's nothing wrong with a crutch, a temporary crutch, nothing at all. Crutches were invented to help bones heal. So when you say a way to keep going until you can find a long-term cure, that's exactly what working with somebody like me is. I posted something a few weeks ago about studies. They've done meta-analyses of studies. So that's what a meta-analysis. It's a study of studies, but of the effectiveness of psychotherapy. And what they found was astounding. It's got a 0.85 success, meaning it influences people 85% of the time in a positive direction. If somebody came out, like imagine this whatever this COVID vaccine, whatever is supposed to have, imagine if it had an 85% effectiveness. People would be like, dude, line me up, It's not. Most vaccines don't even come anywhere near that. The problem with therapy or going and talking to somebody like me is it's associated with weakness. It's associated with mental illness and being crazy. And like I've said since my first broadcast, tell me one person who isn't crazy to some degree. Tell me one person, think of one person who doesn't have issues, because everyone has issues. But because therapy has been stigmatized, and to be quite honest, there's an old school therapist who would have never done something like this. I was chastised when I first started by when I do insurance billing and they call me up and, no, Dr. Walker, what are you doing with this client? And I got to answer to, and basically explain what I'm doing. And I've always said to these people, why don't you call the patient and ask them how they think they're doing? But anyway, and this gentleman, I told him that this was years ago before everyone was doing it now. I gave my patients my personal cell phone number to text me if they're going through anything or if they need follow-ups or whatever. He was like livid. Yeah, you shouldn't be doing that. And I had to just cut him off at some point. And I asked him point blank. And of course he didn't like it. I asked him how old he was. And he said he was in his 70s. And I said, well, dude, I don't think I called him dude, but I said, well, times have changed, man. We actually want our patients, clients to improve. I want the people that I work with to improve. I'm not here just to take people's money. Sure, do I live in an economic-based society where I got to pay for mortgage? And that's another thing. I'm running ads on Facebook, and I got all these, I don't want to say morons, but morons leaving snide little comments on my timeline about advertising and all this. People, if it wasn't for advertising, there'd be no Facebook, or we'd have to pay to use Facebook. So give it a rest. But anyway, sorry. We've got to allow ourselves to be okay with working on our issues. We've got to. Otherwise, it stays in us and it doesn't go away. So George, absolutely. Medication is not a bad temporary crutch. There's nothing wrong with a crutch. I don't think people, when they break their leg or sprain their ankle, they're looking at the crutches going, oh, I'm so ashamed I'm on these crutches. I'm so ashamed I'm on these crutches. Maybe some people with long-term debilitating pain or, MS or something, they're ashamed of it. Sure, I've worked with them. But I'm saying in general, when you break a leg or have a crutch, you're not ashamed of it. Nothing wrong with temporary low-dose medication coupled with somebody like me who can help you work through why you're feeling low, why you're feeling in need of the medication. So again, guys, if you're watching this, please share, please ask me a question, please engage with me, okay? So Diego, hey Diego, hey doctor, I have a friend that I mentioned to about your podcast, thank you. She mentioned that she had depression and is hesitant to go to get mental health. And she told me that the doctor talked about meds, but my question is, how can I motivate her to get the help? Maybe she doesn't need the meds. Yeah. Man, look, I'm not trying to, piss off excuse my language, other providers, but people who don't really know how to help people without medication are going to default to medication. So yes, Diego, if you send her a link to If she's online, send her a link to this, invite her to join, give her some studies on how effective this type of psychotherapy work can be. It's great that you want to help her, but she has got to motivate herself. She's got to find within herself something that gives her the, I want to heal feeling. I want to get going. I want to work on whatever is going on. So you're a good friend to try to help her, but I would point her in the direction of, studies that have shown how effective psychotherapy can be. Maybe, I don't know if you've had your own therapy. Talk to her about that. If you know somebody that has had depression and has worked through it doing this type of work, then maybe they can get involved. The main thing, though, Diego, is, you're doing a good job trying to be empathetic for her. You're trying to support her. So maybe talk to her a little bit about your own depression, your own struggles with depression or things that have brought you down. One of the keys to working effectively with people is to be able to be the ability to be empathetic, the ability to say to them, to yourself, oh, wow, this person knows what I'm going through. And I share a lot of that with my clients. I'm not afraid to talk to people about my own self-work. I'm very proud of it. I'm very proud that I've been able to manage and heal a lot of the underlying crap that I went through as a kid and subsequently was holding me back. The fact that I'm even broadcasting, doing this live, opening myself up for obviously whoever feels the need to insult or whatever, is part of how far I've come, where I used to be extremely self-conscious about my appearance. I used to be very shy about being in front of a camera, talking in front of people. And I, subsequently, as I've gotten more speaking engagements, throughout the years, but I've also worked on the insecurity that I was raised with. So Diego, my brother, I've talked to her about my mental health and drinking, and she was actually surprised I was so open about it, but I will use what you suggest. And bro, text her a link to my website. Here's my website. Well, actually, this one gets forwarded to my YouTube account, but my main website is licensedpsychology.com. So licensed instead of psychologist, licensedpsychology.com. But, she's welcome to send me some questions. Again, just send her a link to this once it's posted on Facebook. Okay. So, but you're a good guy. And dude, you're seeing what I'm talking about when you said that she was actually surprised I was so open. This is what we need, people. We need people open about their own mental health, their own struggles to find happiness. So, great, Diego. Let me know how it goes. Bill's logging on again. Good to see you, Bill. I will get to you in a second. Miranda, again, Diego, I don't know if that helped, but the main thing is to just continue to explain to her there's nothing to be ashamed of. There's nothing to be ashamed of that you're depressed. She's probably depressed about some trauma or something that has happened to her that has caused her to feel bad about herself. Just tell her, take the it's okay pill. What's the it's okay pill? It's okay how I feel. But remember, it's only okay how I feel if I'm working on how I feel. And this is sorry, we just moved out west and the air is so dry out here. But the it's okay pill is making okay how you feel so you can work on it. If you don't make it okay, you're not going to work on it. Okay. So thanks for the question, my brother. And by the way, Diego, how's it going with the drinking? I hope you're still working on that. I hope you're working on some of those family issues that we all have. I hope you're really beginning to question, well, why am I drinking? Like, why do I need this alcohol? What is this covering up? So I hope you're working on that, my brother. So let's get to Miranda, and then I'll get to Bill. Thank you, everyone who's sending questions. Is it safe to begin a patient with bipolar 2 on antidepressants? I read that antidepressants can cause a manic episode without something like a mood stabilizer. Thought, definitely. See, this is the thing about medication is once you take this, then you got to take this, and then this problem creates a problem that you got to take this for, and the next thing you know, you're taking 4 or 5 different pills specifically for one problem. So when you say, is it safe for a patient with bipolar 2, and bipolar 2, by the way, guys, remember we talked about the different types of bipolar. Bipolar 2 is the one that's marked by more depression. So that means that the patient has more depression than they have mania. So what Miranda's saying then is, if you take an antidepressant, and that's why they have these warnings on antidepressants about they can cause suicide. How do they cause suicide? Well, I'll explain that to you. So somebody who is depressed is got low mood, low energy, and a lot of times they don't act on feelings of suicide. Like Miranda's saying, all of a sudden you dump an antidepressant into them and they're feeling good. Guess what they have more of? Energy. More of an ability to say, yeah, now I can do it. So it's not like 50% of the people commit suicide on antidepressants. No, it's nowhere near that. I think it's very low. I'd have to look it up, but I think it's under 5%. But again, that's way too many. So absolutely, Miranda, people on antidepressants who are bipolar 2 need to be prescribed some sort of mood stabilizer so they don't get all rocketed up and think. And by the way, guys, if you're watching this, please share it. Please share it on something to pull more people in. Do not be ashamed that you are talking about mental illness. Nothing wrong with that, okay? So, yes, I would be, I don't know if it's you or somebody you know, but definitely I would monitor that person so that they don't rocket back up and think, hey, now I got the energy to kill myself. So, but again, Miranda, if this is you or somebody you know, somebody on bipolar 2, and granted, there are what's known as organic brain anomalies, meaning that there's a percentage of people who have organically caused mental illness. Very low percent people. I think it's 6, these fluctuate a lot, but it's in the 5, 7, 8, 6, 6 range, that whole range of the general population who has organic, something's wrong with my brain. They ooze with craziness and they need to be medicated, hospitalized, and tended to. That's the percentage. Most of us, whoever this person is with bipolar 2, I would love if that was a client of mine, we'd be getting into what's going on. Where did your mood start fluctuating like this? What happened that's caused this? Most, not all, there's no absolutes, but most mental illness has its root in some sort of traumatic event. It's either a traumatic event, it can be substance abuse induced, and yes, there is a genetic component, even though technically there's still a lot of debate about the ability to pass on mental illness. Again, nature versus nurture, like we talked about last week. So I hope that helps, Miranda. Great question. Miranda, I don't know if you're in the field or if this is a personal thing with you, but that is a very nuanced question about medication and with mental illness. So, okay. So you started on Paxil and use Boost Bar, and neither are a mood stabilizer. Well, Miranda, then you got to be your own mood stabilizer, sister. You've got to figure out what is going on with you, emotionally, that is causing you to be so depressed. Now, when you say that you have a clinical diagnosis of bipolar 2 from a physician or a psychiatrist, so I'm thinking, if you're more depressed than up, how high are your ups? Like, do you get really manic where you're like writing or working or cleaning or whatever we can do in a manic state where you just have tons of energy? How high are your ups? What is going on in Miranda's past? What happened growing up or what happened recently that is causing you to be so depressed? What is your relationship with yourself like? You guys have heard me talk about this before. Is Miranda hating herself a lot? Is Miranda at odds with herself? So I would be very careful, Miranda, if you are feeling that up feeling of, yeah, now I have the energy to, I don't know how, if you struggle with suicidal ideation or anything like that, but I would definitely have some sort of safety plan in place with either somebody who you care about, yes, bipolar 2 by a psychiatrist. Beautiful. So I don't know if your psychiatrist is trained to do therapy or if you guys talk or you just show up and get the meds. But I don't know if you're working with a mental health person, but I would definitely encourage you to begin seeing the medication as a short-term aid to helping you heal. Because I know the thought of being off your medication and being, up and down is a scary thought. But again, remember, if we don't expose ourselves to a certain degree of pain, we're never going to get used to how we manage it. And I'm not preaching to you. I'm not saying you have to get off your medication, because like some clients say to me, hey, if I had high blood pressure, or if I had diabetes, or if I had whatever other physical ailment, I would be on medication, and there's nothing wrong with medication. Absolutely. And I'm not going to try to convince somebody to get off a medication that they don't want to get off. I don't feel like I have extreme ups, but spending sprees. Okay. So you buy things in order to feel good. Maybe you buy things in order, and I'm going to get to you, Bill. Don't hold on, and Diego, I'm going to get to your follow-up if you guys are still on. Maybe you're buying things as a way to give you some control. Maybe you didn't have a lot of control as a kid, so this is your way of getting control. Pete just logged on. Thanks, Pete. I'll get to you in a second. Thank you for all these questions. Please share this, Pete. Pete, Miranda, Bill, Diego, everyone, please share this, okay? We need to pull some more people in. So, Pete, don't log off. This is a great question. I'll get to it in a second. So, Miranda, I would look at what the spending sprees are doing, sister. Like, why am I needing to buy things to feel good about myself? Is that a self-esteem thing? Is that a control thing? Is that a way for you to feel like, oh, cool, like I have the ability to buy something? What does the compulsive buying do for you? Okay. I have a client who I've been working with for years who had some sexual trauma, and she used spending as a way and buying things as a way to give her a sense of value. And she subsequently worked through that and done amazing work. We had a great session today on the phone, and she was just feeling so good. She had finally crossed over one fear she had of confronting a family member. So all I'm saying, guys, is, and if you guys heard her story of the abuse she went through, everyone can heal, but you got to work on it. Okay, Miranda, so I hope that helps. But you got to look at remember we talked about the ABCs of thinking: activating event, belief, consequence. Miranda's activating event is spending, buying. What does she believe about that? Remember, activating event happens. I impose a belief upon it. Those beliefs have consequences in the form of feelings. I start losing my hair in my 20s, big activating event. I start believing, oh no, this is the worst thing in the world. I'm going to look like my grandfather. No woman's going to love me. I hate belief upon an activating event. The consequence of that is I get depressed. I start feeling my self-esteem goes down. Miranda, your ABC here, activating event is spending, buying, looking at things on QVC or whatever. What do I believe about that? Oh, I like shiny things. I like new things. Oh, that makes me feel good about myself. The consequence of that belief is I keep spending, I keep buying. You got to get into it, Miranda. You got to think about how the spending is keeping the other mental illnesses in check, okay? So back to Bill. Hope you're still on, Bill. Let me see here. I would agree with the SSRI analysis. I would be more interested in some thoughts on medical marijuana as a treatment partner to positive frequent psychotherapy. Great question. Stay away from the evil weed. Weed is bad. No, I'm kidding. I would definitely encourage people to, if you have a state that allows medical marijuana, find a way, and you're not going to get into any kind of legal issues with work or whatever. There are some very interesting studies about marijuana's ability to help with mood, anxiety, schizophrenia, PTSD. But the key, okay, Bill, the key is dosing. How much do you dose? There are also studies that talk about overdosing, meaning that people who are chronic users, wake and bakers, People who use a lot, that's associated with psychosis, elevated levels of paranoia. The key is, I would say, is balance, okay? I am always for natural cures over pharmacological chemistry, chemicals. Now, that has to be couched with, why is Bill needing some marijuana? What is going on with Bill that is maybe causing him to be depressed? Again, we've got to look at why the need for the medication, whether it's marijuana, whether it's SSRI, what is fueling my need for this medication? That is the key. I don't want to say there's a conspiracy, but clearly pharmaceutical companies don't want people to get completely healed because then they lose revenue. I'm not saying that that's their motivation. I'm just saying that you've got to look at, what is causing it. So I would tend to agree with Bill. Look at all avenues. Look at all avenues before you decide that a chemical produced by a pharmaceutical company is your only option to feel better. Absolutely. Great question, Bill. But yes, combining it with psychotherapy, because by the way, every single study that has studied medication alone, psychotherapy alone, or medication and psychotherapy together, that is the combination that produces the best results for a certain type of patient that has maybe endogenous, which is deep-seated or deep-rooted anxiety or depression. Some people can get great benefits from psychotherapy alone. Some people can get, symptom relief from medication. But remember, that is what medication does. It's symptom relief. It relieves symptoms. It does not cause you to work on, meaning it doesn't cause a change in what precipitated the need for the medication. Okay, thanks, Bill. So Diego is just following up here. My issues are diminishing. Excellent, bro. And the mere fact that I'm belittling my issues and being open about it is making me so much better with me and my fam. Excellent. That was the key. Man up and be open about how I have these issues and let it out. Thank God I don't need meds. Great, Diego. Excellent. But bro, you got to keep doing the work, dude. It's like working out. And I used to be in a lot better shape. The minute I stopped working out, okay, it's the same thing with this type of work. You got to stay vigilant, brother, to why you were drinking. You got to keep asking yourself those deeper questions. Why was I drinking so much? What was I trying to prove? Was I trying to just fit in? Is that what I learned? What was I trying to cover up? Diego has talked about some issues he's had with growing up in his family and how that has caused it. So Diego, keep working on the self-awareness, brother. Keep working on what is causing you to need the alcohol. And yes, when I say man up, I'm not trying to be sexist, but that was me just talking to Diego saying, men need to man up and stop acting like being a man is repressing your emotions, only keeping your emotions locked in your head, being afraid, oh no, I can't show fear and weakness, holding that crap in. That's why they call anger a secondary emotion. What does that mean? The primary emotion that most men feel is hurt, but they don't show it because daddy told them, probably as mine did, hey, don't cry. We don't cry. I never saw my father crying. And that's what we learn as men. So I'm glad to see Diego is working on that conditioned belief system, brother. Okay, Pete. How's it going, Pete? Thank you for joining. I hope you're sharing this. Do some people have low-level depression throughout their life that they can fight with exercise and hard manual labor? Absolutely. So what I'm guessing, my brother, is Pete's had some low-level depression his whole life that he's fought with exercise and hard manual labor. Yes, I'm sure you've gotten some relief. Please, guys, share this, okay? Pull some more people in. I don't want to be one of these YouTubers. It's just, hey, I'm the smart guy and listen to me and, I don't care. Questions, okay? So, Pete, what I would ask you, bro, is what's been going on? Like, why have you been depressed most of your life? Why haven't you worked on that? Why haven't you sat down and thought about, why am I so depressed? Like, what's going on with me? Why do I need to fight my depression? And this is another thing, guys, and if people have worked with me personally, they know I'm not a big proponent of fighting. I know we live in a very fight-oriented culture, but that's not always, we don't always have to fight negative stuff. A lot of times when we attack our depression, it attacks back. So one of the things I would encourage Pete to say to himself is, remember the it's okay pill. It's okay that I'm depressed. It's okay. Now let me work on that. I don't know if you're still on, Pete, if you want to follow up, but if you're still on, I'll ask you point blank. What happened to little Petey? What happened to little Pete when he was younger? Did he go through some trauma? Did he live in a depressed family? Did he has he struggled? Is he struggling with some other issues that he's never really come to terms with? So yes, absolutely, you can. Sorry, people are asking more questions. Beautiful. You can absolutely. I don't want to use the word fight. You can substitute things that take your energy away from the depression, like exercise and hard manual labor. But the problem is, Pete, as you get older, you're not going to be able to contain. It's going to become uncontainable at some point. And I've worked with a lot of older people. I am convinced that what we see as a lot of these old age illnesses where people just lose their mind and they just become, just deranged, or they just lose it, is because they spent their whole life trying to compartmentalize these negative thoughts and emotions. And after a certain age, you can't do that anymore. So brother, I would encourage you to just tonight or whenever you're ready, talk to yourself. What's going on with me? Why have I been depressed throughout my entire life? When did this happen? Did I not get enough love growing up? Did I get too much love and all of a sudden nobody can give me enough of the love that I need in order to feel good about myself? You got to ask yourself the deeper questions of why. I know people say, why ask why? Tell that to a scientist looking for a cancer cure or a COVID cure. Why? Why? Just treat the symptoms. Sorry, BS. You need to get into the whys. Why am I depressed? Why am I down? So yes, Pete, the answer to your question is yes, absolutely. You can hold off depression through, working really hard and exercising. But bro, you're not going to be able to do that forever. You got to come to terms. Pete's got to say to himself, it's okay that I'm depressed. It's okay. But now let me do something about it. Remember, I call that active acceptance. Passive acceptance is Pete says, oh, okay, I accept that I'm depressed, so I guess I'm just going to stay depressed and nothing's ever going to change. That's passive acceptance. Active acceptance, and by the way, activeacceptance.com will take you to my website. Passiveacceptance.com will take you to my website. Active acceptance is it's okay that I'm depressed. It's okay that I've had this low level depression my whole life, but I got to work on that. Okay. So I hope that helped, Pete. Shoot me a follow-up or, thank you. Great family. Okay. All right. Well, then you got to look a little deeper. Maybe I don't know. Maybe Pete's got some deeper issues, or maybe there's something going on, but there's nothing wrong with it, bro. There's nothing wrong with it. Absolutely nothing wrong with being depressed. Everyone's depressed. Everyone has depression, myself included, everybody, but you got to work on it. Okay. So let me just get back up here. Poignant response. Thanks, Bill. Miranda saying I'll PM you after I never got back to you. No problem. Diego says, is following up. It was the beatings from my father, who was the alcoholic, and I'll keep it up. Wow. Yeah, bro. Yeah, dude. It sounds like, little Diego had the blank kicked out of him, and, he grew up with a lot of violence and a unstable father. And, Diego, it's great that you're working on it. And I encourage you to keep getting it, to try to get into a place where you can go back to, not on your own, but work with somebody that you can go back to some of those moments when you felt like that helpless, beaten child, to feel some of that pain inside of you so you can start controlling it rather than in controlling you. But thank you for sharing that. Beating children, I know that that's the old school method of shaping behavior, but there are multiple ways to shape the behavior from a child with a child. And we have a 4-year-old, and to date, he has never been hit, and he is very well behaved. He has his moments. He inherited, my wife and I's strong personality, but we've found a way to shape his behavior without violence. And I am not a proponent of violence. Now, I'm not saying coddle and all that. I don't coddle him, but I don't believe in beating children. And Diego, you're a perfect example of why, because this is why people who raise dogs, what do they do from the early on? They beat the dog. And so the dog's more aggressive. So, great, Diego, but you gotta, now that you're realizing that a lot of that was learned behavior, and your dad was an alcoholic. So you saw that, and you see where you got a lot of that. Okay. So let's get to some more questions here. Somebody from Twitter is asking, yes, it's okay to admit your fears. Absolutely. BS, that's the person's initials. Absolutely, it's okay to admit you have fears. That's the whole idea behind this work, is you admit, yes, I am scared of XYZ, and now I need to work on it. Because if you don't work on it, if you don't admit it, then how the hell are you going to work on it? So I do not touch my kids, Diego saying, I'm not my father. Beautiful. I hear you, man. I'm with you, Diego. One of the main things my father taught me, and he wasn't all bad, but the main thing my father taught me was how I didn't want to be a father, because that sometimes is what you need to go through in order to, learn how to be a dad. So, yes, absolutely, BS, from Twitter. Please share this if you're on Twitter. Yes, it's okay to admit your fears. Absolutely. It's okay to admit to yourself that it's okay that I have fears. And then you have to systematically start working on them. Because like we talked about in a previous broadcast, fears, if you break it down into, it's an acronym, FEAR, false evidence appearing real. Great acronym, because what it is that's exactly what fears are. We become afraid to even, I forget which president who said that. I'm sure somebody will let me know, but the only thing we have to fear is fears itself. I think that was Truman or Eisenhower, one of them. But anyway, but it's so true. The only thing we have to fear is fear itself, because fear will convince you. You have fear of fear, basically, because it'll convince you that no, there's no way I can live with these fears. Absolutely. I'm the only one that has these fears. Nobody else has these fears. So absolutely, we definitely need to work on admitting that we have fears and working on them. Okay. Miranda's following up something that I found a little odd. Benzos are, benzos are Benzes, right? Yeah, benzodiazepines is what the benzo is. Talked to my MD about anxiety, and we talked about Xanax and Ativan. Oh my God, those are just so strong. And she didn't like the idea. Great, but I was okay with Valium, as long as, again, you're understanding what Valium is. So am I missing something? You're not missing something, Miranda, but there's obviously something that you're trying to not deal with. There's some negative emotion that is causing you to need Valium. And Valium is basically just pill form of alcohol. That Valium is like, it works on almost the exact pleasure pathways in your brain. That's why they say, don't take Valium with alcohol. But what do people do? They take it with alcohol. But, yeah, I'm glad your physician was steering you away from benzos, because benzos are they literally go right to your central nervous system, and they can become addictive. They can mess you up. If you stop taking them, you can have seizures. So when you say, am I missing something? What do you mean by that? What does that mean? Are you missing something? I would encourage you to look at, honestly, Miranda, what are you missing? Meaning, what within you are you missing that is causing you to need this medication? When did you first have this anxiety? What age? BS. I don't know who you're talking to, so maybe they'll answer, but thank you for interacting. Rose is saying, great topic. Some of my medicines have caused me ulcers and codependency issues. Have been battling, coming off most of my medications and going the holistic route. Pain is your friend to a degree, true, that your body's telling you you're alive and well. And then, and that's indicating where some needs to work, where in your body needs work. Yes, I suffer PTSD, but nothing is better than exercise and yoga and meditation. Yeah, I've often said that the word medication and the word meditation is only off by one letter. So I'm a big proponent to meditate instead of medicate. But again, remember, I'm not saying all medication's bad. And if you're on medication, you should be ashamed of it. I'm not saying any of that. Excuse me. So Severina's saying, okay, yes, I get definitely depressed when I think that I'm not enough for someone because of my job. For example, when someone flirts with me and we start talking and it gets to the question, what do I do for leaving? What do I do for leaving? And I answer, their face change, for a living. And then their face change and I lose interest, or they do not think I'm valuable enough. Well, again, Severina's been attended a couple of our broadcasts, and she shared some of the trauma she went through with her mom. She's talked about being in a relationship with a narcissist who was very abusive. Absolutely, Severina, you have got to start rebuilding your relationship with yourself. Okay, sister? If you are waiting for the outside world or someone to come into your world and make you feel good about yourself, you're going to have a long wait. We call that in psychology external locus of control versus internal locus of control. External locus of control is I need all my clients and all my patients to tell me, oh, you're so great. Man, I would be lost without you. You're so wonderful. I need that in order to feel effective. Internal locus of control is me saying, I don't need anybody's opinion. I know I'm Mr. Wonderful. Obviously, you need a balance somewhere in between where you find an external and an internal balance. Severina, you got to work on your relationship with yourself. That trauma, that poisonous, untreated emotional wound is pumping out infection into your stream of consciousness, and you're thinking things about yourself that are specifically driven by that trauma. You got to work on that, sister. Okay, you got to start working on your own value. And I know it goes back in you a ways, but remember, you have self-esteem. We have self-esteem. We have low and high self-esteem. We all have that. Try to focus a little bit of your attention on the conditioning, the trauma that has caused you to feel bad about yourself. Start questioning that. Remember, I call that questioning your conditioning, meaning you're asking yourself, hey, think about it in terms of racism. Let's say there's a white guy who's been taught his whole life that all black people are Mexicans, or even vice versa. A black person who's been taught that all white people suck. You got to question that. The minute you start questioning that, those belief systems start slowly falling apart, and you start thinking, really, why am I hating this black dude? Why am I hating this white guy? I don't even know them. Okay, so Severina, yes, you're never going to get value. Well, I shouldn't say that, not never. The value you get from external sources is much more difficult to maintain, okay? Because remember, if I need all my patients to tell me how wonderful I am, what happens when they tell me I suck? Or what happens when they tell me I'm a quack? Or what happens if they never tell me that? Then where do I get my sense of effectiveness from? You got to work on that from within, and you got to work on what is causing you to feel bad about yourself. I do house cleaning. I just don't understand why it's so bad. It's not. I like my job. There's dignity in everything. I've washed dishes. I've had some of the most, there's nothing wrong with it. But so what if somebody, you got to look at, why do other people's opinions of you affect you so much? Okay. You've got, like, Pete's chiming in saying, good people will greatly respect your work, Severina. Thanks, Pete. Severina has got to work on what she's telling herself about. Do something here. I just lost all the messages. So anyway, we're coming to the end here. I don't know if I just messed up the stream. Hope not. But we've got to work on, Severina, you have to work on your relationship with you. Okay? You got to work on your relation. Oh, I see what I did. I just changed the graphic there. Sorry about that. So yes, Severina, you've got to work on how you're feeling about you. You've got to, because until you fully work on that, you're going to need other people's perceptions of you, other people's opinions of you in order to feel good about yourself. And you're right. There is nothing wrong with house cleaning. Nothing at all. Nothing. In fact, the idea that there should be something wrong with that is something within you, not me. Sorry for the misunderstanding. She was okay with Valium, but not the others, wondering why she was okay with Valium, but not Xanax. Oh, I see. Or Ativan, if all benzos are the same, because if others are bad, why would she be okay with Valium? Great question. And I can't really answer why. I just know that Miranda, benzos and those types of medication need to really be managed, okay? They really need to be managed, okay? So because if you don't, they can get a hold of you, and then the next thing you know, you're hooked on them. So anyway, guys, thank you for tuning in. Back to Severina real quick. Severina, you've got to begin working on that low self-esteem, that part of you that feels so bad about yourself that you can't find value in what you do. That is something that your ex, your mom, they literally beat that into you and made you feel that about yourself, and you've got to spend some time working on that. So again, guys, remember, Monday, Wednesday, Friday at 9 p.m. Please share this if you're watching this after the fact. We need more people to discuss their mental health and their mental illness. There's nothing wrong with it. We all have a degree of mental illness. Miranda, just to close out here, whatever you're looking for the medication to make you feel good on, you got to work on what's causing the need for the medication, okay? And I'm not saying that lightly. I'm not saying that like I'm putting you down or whatever, but you've got, I don't know how old you are, Miranda, but I mean, I'm 55 years old. I don't know where on the aging continuum you are, but you got to ask yourself, okay, if you're in your 30s, 20s, 30s, where am I going to be in my 40s and 50s on these medications? What's the plan? Okay, Miranda. So I would encourage you to begin accepting that there's something within me. There's some unhealed emotional wound that is causing me to need medication. Okay. So guys, thank you for tuning in. Sorry for that little technical glitch a little while. You're welcome, Severina. Thank you again for your time. Please work on what's causing you to feel bad. Thanks, Pete. I appreciate you sharing. Please work on what is causing you to feel bad about yourself, guys. You're going to see that a lot of that is learned behavior. You got to learn that that is learned behavior. That's the only way you're going to begin to transcend that. I've shared some of my own struggles of the self-hate I used to struggle with. I've worked on it. So I encourage everybody, do not give up. I'll see you Wednesday night at 9 p.m. I'm going to keep doing these as long as people are tuning in. If you're enjoying them, help me share them. Help me get more people to tune in, okay, so that we can get conversations about mental health and mental illness normalized, okay? So I hope everyone has a good night. I'll see you Wednesday night, and we'll keep the conversation going, okay? Take care. Have a good night. Thanks for all your questions and comments, and please share this, all right? Take care.